Q1. Patient bring own medication to hospital and wants to self-administer. Your role? Allow him. Give medications back to relatives to take back to home. Keep it in locker, use from medication trolley. Explain to PT about medication before he administer it. Q2. A patient asks a RN, "Can I tell you a secret?" What is the RN's best response? Yes, because it develops trust, which is central to the MPR. Yes, and I will share it with the relevant medical team. Yes, I will share it with all the medical professionals who are supposed to know the secret. Yes, I will keep the secret because it is confidential. Q3. Patient suspected of UTI. Hand hygiene and promotion of infection link nurse. Ask doctors to wear gloves, gown. Use PPE while dealing with body fluids. Review antimicrobial daily and report healthcare team. Q4. Steps in nursing process. Assessment, planning, implementation, evaluation. Assessment, planning, audit. Q5. An old admitted patient comes up with a new confusion: Alzheimer, dementia, normal aging, infection. Q6. Which of the following cannot be seen in a depressed client? Inactivity, sad facial expression, slow monotonous speech, happiness. Q7. The nurse is admitting a client. On initial assessment, the nurse tries to inquire the patient if he has been taking alternative therapies and OTC drugs, but the client becomes angry and refuses to answer, saying the nurse is doing so because he belongs to an ethnic minority group. What is the nurse's best response? The nurse will stop asking questions as it is upsetting to the patient. Wait and give some time for the client to get adjusted to modern ways of hospitalization. The nurse will politely explain to the patient about alternative therapies such as St. John's wort, which interact with drugs. The nurse will assign another nurse to ask questions. Q8. There is a child you are taking care of at home who has a history of anaphylactic shock from certain foods. The nurse is feeding him lunch. He looks suddenly confused, breathless, and acting different. The nurse has access to emergency drugs access and the mobile phone. What will she do? She will keep the child awake by talking to him and call 911 for help. She will raise the child's legs and administer adrenaline and call the emergency services. The nurse will keep the child in standing position and try to reassure the child. Q9. After abdominal surgery, patient complains of pain even after administration of analgesics little ago. Apply heat. Position to reclined position Alzheimer. Call the doctor. Read minister analgesic. Q10. What is the minute required hours for in-service education in UK for 3 years? 25, 35, 45, 55. Q11. Nurse and colleague found a discrepancy of controlled drug. How to report? Inform police. Inform pharmacy. Recheck, inform in charge. If not found, inform senior nurse. Q12. A Jewish patient refuses blood transfusion in a critical situation and states that his religion is against it. What should the nurse do? Ignore patient's will and give him blood. Tell the patient relatives to take decision. Accept the client's will. Force the client to give consent. Q13. There is a Chinese client in your care and the relatives of the client insist upon bringing their own food for the client. What is appropriate for the nurse to do? Accept the wish under Western foods and cultural differences consideration. Refuse the client's wish as the food might carry infection. Ask the next of kin to bring in the food and hand it to the dietary department for necessary changes to be done in diet. Q14. A pregnant client with a history of alcohol addiction is scheduled for a non-stress test. The non-stress test determines the lung maturity of the fetus, measures the activity of the fetus, shows the effect of contractions on the fetal heart rate, measures the neurological well-being of the fetus. Q15. In a canteen queue, patient collapses in front of you. What will be your response? Run to bring AED. Shout for help. Asks for response. Asks for danger before approaching. Q16. Which drug causes fall in elderly? Loop diuretics, beta blockers, NSAIDs. Hypnotics. Q17. Protective diets are full of antioxidants and are helpful in diseased conditions. What from the following can be included in protective diet? Tomatoes, carrots, and broccoli. Beef, fish, and chicken. Eggs, dairy, and cheese. Rice, beans, and pasta. Q18. In COPD patient, what we see: CO2 high, PO2 low. CO2 low, PO2 high. Q19. Who is responsible for disposal of sharps? Doctor. Nurse. HCA. Professional who uses the sharp. Q20. After completion of nursing notes, nurse should sign printed name, designation, time, date. Sign designation, time, date. Sign time, date of birth. Q21. Diarrhea. Which condition does not show this as a sign? Hashimoto's syndrome. Ulcerative colitis. Q22. Dehydration in old adult. Decreased turgor. Elasticity. Q23. Electronic data transfer is more these days. Which of the report is not suitable to send to a discharged client? Confusing blood report. Smoking cessation policy. Q24. A 25-year-old girl with learning disabilities is admitted for a minor surgery. She is very restless and agitated and wants her mother to stay with her. What will be your response? Until she settles. Tell her visiting hour is over. Tell her you will take care of the child. Q25. A terminally ill patient tells the nurse that he doesn't want CPR. What should the nurse do? Force the patient that CPR is very important. Ask relatives to talk to patient. Tell the patient that his decision is absolutely right. Explain him about advance directives. Q26. Postoperative, the nurse finds the client producing gurgling sounds from the throat. The nurse knows these sounds are normal due to anesthesia effect in immediate postoperative phase. The nurse must immediately insert LMA, laryngeal mask airway. The nurse knows that the client's airway is partially occluded. Q27. As a registered nurse, how will you advise a new registrant who is confused about avoiding to make assumptions about patients and give effective care in accord to the Code 2005? Promote professionalism and trust. Prioritize people. Practice effectively. Promote safety. Q28. There are two types of diabetes, type I and type 2. Which symptom is the most common in type I diabetes mellitus? Blurred vision. Thirst. Weight loss. Ketoacidosis. Q29. Independent mental capacity advocate. When will an IMCA make a decision for the client? When there is a close family member. When there is a close friend present. When there is intermittent mental illness in patient. When there is no friend and family present to make a wish or take a decision for the client. Q30. You are caring for a Hindu client and it's time for drug administration. The client refuses to take the capsule, referring to the animal product that might have been used in its making. What is the appropriate action for the nurse to perform? She will not administer and document the omissions in the patient's chart. The nurse will ignore the client's request and administer forcefully. The nurse will open the capsule and administer the powdered drug. The nurse will establish with the pharmacist if the capsule is suitable for vegetarians. Q31. Proper way to remove vacuum drainage. Release vacuum and remove. Pull out. Get doctor to do it. Q32. What are the symptoms of compensated shock? Tachycardia, vasoconstriction, and confusion. Bradycardia, low blood pressure and drowsy. Circulatory collapse, cardiovascular dysfunction, brain stem damage. Q33. A nurse is administering a controlled drug at home. What precaution does she need to take? Stick to local policies and guidelines. Don't give rest of the medication to relatives. Don't leave balance of medication in home. Q34. While mentoring a final year student dispensing medication. Nurse role. Direct supervision. Before delegating, find out he is competent. Ask him to tell after the administration is complete. Q35. A nurse is performing covert administration of drugs to the client. Which of the following is an appropriate explanation of this? Covert administration of drugs to clients is ethically and professionally wrong. Assess the deprivation of liberty safeguards and mental capacity of the client and then administer in accordance with the multidisciplinary team care plan. Covert administration of drugs can only be allowed if the client's next of kin advises so. Q36. The nurse observes another colleague telling a patient harshly that you will not be allowed to go to bed until you finish your meal. As a newly registered nurse, what will you do? Raise your concerns with the ward sister and let her investigate the incident. Challenge the practice, as it is disrupting the dignity of the client, and then talk to the line manager. Ignore the happening as it is the other staff's discretion as to how she does her work. Let the nurse leave and inquire yourself about this happening with the patient. Q37. Which is not the complication of speed shock? Cardiovascular collapse. Peripheral edema. Q38. Not a sign of meconium aspiration syndrome. Baby crying. Floppy appearance. dark greenish appearance. Q39. A patient wants to leave hospital against medical advice. The doctors are concerned about patient's competence under the Mental Capacity Act. What should the nurse do? Let the patient go. He is competent and in his full sense. Call the police. Restrain the patient. Call the security and make the patient stay until the doctors complete their assessment. Q40. Registered RN role, while administering medicine. Should know about all medications. Should know about medicines, explain to patient to make them understand why they are taking them. Forgiving for medicines, get help of other nurse. Q41. Biohazard label on a bottle in nursing counter. Double bag it, sealing bag and wear gloves while handling specimen. Use gloves. Inform lab before transferring. Q42. Which step is not right to follow while using walker? Use outside. Take small steps. When getting up, raise from chair by pushing with palms on armrest. Q43. Removing plaster cast of a child who is not cooperating. Explain to him according to his own understanding in age-appropriate language. Forcefully remove. Q44. Ideal wound dressing characteristics. Gaseous exchange, high humidity, absorbent. Adherence, insulation, low humidity, high humidity, anaerobic. Q45. When to keep patient's privacy and dignity. Under all circumstances. Not in emergency. Q46. After LPPT becomes unconscious. Reason: CSF leakage, headache, herniation. Q47. When can you disclose information of a patient? Justified by public interest and law and order. Law and order. Q48. During shift change, nurse gets over from in charge to follow standard precautions, follow hand hygiene, wear apron and gloves whenever necessary, discard the needles properly and keep the environment clean and protect yourself and patient. Using PP standard precautions. Q49. The nurse is responsible for performing a neonatal assessment on a full-term infant. At 1 minute, the nurse could expect to find an apical pulse of 100, an absence of tonus, cyanosis of the feet and hands, jaundice of the skin and sclera. Q50. Why are old people afebrile even if they are infected? Immature mast T lymphocyte. Interruption of non-adrenaline activity. Please like and subscribe.